All right, well, it was in October of last year, the Trudeau government instituted a mandatory vaccination policy for those traveling on planes and trains in the country. Well, now one expert is calling for that policy to be rescinded. Infectious diseases physician at St. Joe's in Hamilton, Dr. Zane Chagla, joins us live this morning on CP24 Breakfast. Dr. Chagla, thanks for being here. Let's talk about the crux of your argument here. What are you pushing for to happen?
Yeah, I think these policies came in place with one goal in mind: to keep people at low risk of transmitting the infection beside people that are low risk for transmitting the infection, and hopefully that environment reduces transmission and makes it much safer. The problem is with Omicron is everything has changed. We do know, for example, 2 doses of vaccines offer very little protection against Omicron infection, very good protection against severe disease. 3 doses may offer some benefit, but it really is temporal, weans over time. There are children on flights that are functionally unvaccinated, and so they're around as well. And there are people that have gotten Omicron that are that are not vaccinated, but probably have some immunity to this virus equivalent to a vaccine. And so when you're starting to add all of those things together, the likelihood of a vaccine mandate causing some significant reduction in transmission on a plane or a train really starts coming down significantly. And so, I think we need to revise this policy and really consider everyone being eligible, regardless of their vaccine status, to travel on a plane or a train.
Okay, and so if the vaccine mandate went away, what would your thoughts be on keeping masks on planes and trains, et cetera?
Yeah, I think we do one thing at a time. The masks may be a nice way to transition, to deal with crowding, to deal with other complications in that sense. But we have to look to the evidence, and I think the United States, they're taking off masks with plane travel, or at least making it not mandatory. And so, there's going to be a lot of data coming out in terms of what that looks like for travel, for absences, for transmission on planes. And, as that data emerges, we take a look and see whether or not that mandate is needed long term.
Now, part of these mandates, it seemed, Dr. Chagla, was to sort of almost incent people to get vaccinated, sort of protect themselves, protect, others in the public that you sort of may come into your sphere of contact, et cetera. If the mandate goes away, though, do you have any concerns that the uptake of vaccines or the interest in getting vaccines would wane as well, or are we kind of past that now?
I think we've hit our peak. When you look at from November 30th, where, proof of testing was lost as part of the ability to go on a plane or a train, you really just had to be vaccinated outside of some certain circumstances, to now, there's only been about 3% of the population that's become fully vaccinated in that interim. And you could say there's a number of other reasons there, like local vaccine mandates and passports, workplace, controls, et cetera. So I think we've hit our peak. There's a lot of money being invested into this system, though. And again, is there a need to pivot some of that cash into more pro-vaccine uptake in communities, more communication, more support for clinicians and physicians to really counsel their patients on top of, the other medical demands that are going on? There's lots of ways to expand that vaccine access outside of these types of policies.
Okay, and finally, one thing I noticed in the piece that you wrote for the Globe is the risk factor changes depending on sort of who you are, your health status, and in many cases, it comes down to age as well. Could you sort of explain that part of your argument too? Yeah,
absolutely. So, one of the arguments is people are at higher risk of severe disease if they're unvaccinated. And that is true to a point, but age is still a major issue. A 70-year-old with a medical condition who has 3 doses of vaccine still has a higher risk of hospitalization than an unvaccinated 30-year-old. And so we shouldn't necessarily be making decisions based on the risk of severe disease, given there's still a gradient there that some people who are unvaccinated, they're still lower risk than people that are fully vaccinated. And again, we should be encouraging vaccinations in that individual as part of normal travel, as we would encourage hepatitis vaccines and other vaccines as part of that, instead of necessarily using their risk of severe disease as a way to, use a vaccine mandate going forward.
Okay, certainly a thought-provoking piece. You acknowledge it was going to be controversial. Thanks for coming on and joining us this morning, Dr. Chagla. Appreciate the time again.
Take care, Nick.